So today, I'm going to perform passive range of motion exercises. For our assessment, first, be aware of client's medical diagnosis. Second, familiarize yourself with the client's current ROM or range of motion, and then note any joint pain, stiffness, or inflammation that may limit client's motion. And then after that, assess client's level of consciousness and cognitive function. And then our expected outcomes includes the client will maintain or improve current functional mobility in all involved joints and extremities. And then the client will regain or improve strength or voluntary movement in all involved joints and extremities. And then for our equipment needed, there's no special equipment needed except for the gloves when in contact with body fluids if possible. Good day, ma'am. I am Rachel Memorials, ma'am. I will be your student nurse for today. May I check your wristband, ma'am? Can you please state your full name, ma'am, and your date of birth?
My name is Marjorie M. Sosa, and my birthday is December 2, 2001.
Okay, sounds good. Check doctor's order to determine whether the patient is advised to perform any of these exercises depending on her condition. Today, ma'am, I am here to assist you with passive range of motion exercises. So we're going to exercise some of your joints and extremities, and I'll be needing your full cooperation, ma'am. Is that okay with you, ma'am? Yes. Okay, ma'am. Thank you. But before we get started, ma'am, I'm just going to wash my hands and I'll be right back, ma'am. Okay, ma'am. Wash hands and wear gloves if in contact with body fluids are possible. It is to prevent transfer of microorganisms. Next, provide client privacy, including exposing only the extremity to be exercised, and this procedure is a personal matter, thus, privacy must be maintained. Next, adjust the bed to a comfortable working height for performing ROM. Let's higher the head of the bed. And then, lower bed rail only on the side you are working. It is to allow easy access to the patient. After that, describe the passive range of motion exercises you are performing or verbally cue client to perform ROM exercise with your assistance. Okay, ma'am, so we're going to perform passive range of motion exercises. It is from your head to toe. It helps maintain joint mobility and prevent some of the complications associated with lung immobility. So if you have any pain as we do the exercise, just let me know, ma'am. Okay?
Okay.
And then, position the client in a sitting position if possible or as tolerated. It is to provide comfort to the patient. Our patient is now in a sitting position because we raised the head of the bed earlier. And now, let's start the client's head and perform ROM exercises down each side of the body. During the procedure, observe client's joint and face for signs of exertion, pain or fatigue during movement. If client complains of pain, discontinue the procedure. So let's perform ROM exercise first to the neck, which includes already the head. So we have flexion and extension, and we'll do the procedure 5 times each. flexion, extension, flexion, extension, flexion, extension, flexion, extension, flexion, extension. And then next is hyperextension. 1, 2, 3, 4, 5. And let's do it to the other side. 1, 2, 3, 4, 5. After that is the neck rotation. 1, 2, 3, 4, 5. And then let's turn head side to side. 1, 2, 3, 4, 5. Now let's perform ROM exercise for shoulder. First is flexion and extension. Flexion, extension, flexion, extension, flexion, extension, flexion, extension, flexion, extension. Next is abduction and adduction. Abduction, adduction, abduction, adduction, abduction, abduction, adduction, abduction, abduction, adduction. Then inner and outer rotation. Inner rotation, outer rotation, inner rotation, outer rotation, inner rotation, outer rotation, inner rotation, outer rotation, inner rotation, outer rotation. Last is circumduction. 1, 2, 3, 4, 5. And now let's move to ROM exercise for elbows. Flexion, extension, flexion, extension, flexion, extension, flexion, extension, flexion, extension. Then we also have supination and pronation. Supination, pronation, supination, pronation, supination, pronation, supination, pronation, supination, pronation. And now let's move to ROM exercise for wrist and fingers. We have here flexion, extension, and hyperextension. Flexion, extension, 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 hyperextension. Then we also have radial flexion and ulnar flexion. Radial flexion, 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 ulnar flexion. And now let's move to the fingers. We have here flexion, extension, flexion, extension, flexion, extension, flexion, extension, flexion, extension. Then flexion, extension, flexion, extension, flexion, extension, flexion, extension, flexion, extension. Then we also have abduction and adduction. Abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction. And then let's do it to the remaining fingers. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Then we also have opposition to 2 little fingers. 1, 2, 3, 4, 5. Are you ready to work on your life now?
Yes.
Okay. So now, let's perform ROM exercise for hip and leg. We have here flexion and extension. Flexion, extension. Flexion, extension. Flexion, extension. Flexion, extension. Flexion, extension. Next is inward and outward rotation. Inward rotation, 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 outward rotation. Next is for ROM exercise for knee. We have here flexion, extension. Flexion, extension. Flexion, extension. Flexion, extension. Flexion, extension. Now let's move to ROM exercise for ankle. Give here plantar flexion, dorsiflexion. 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 Then we also have inward and outward rotation. Inward rotation, 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 outward rotation. Now let's move to your toes. Abduction, adduction. Abduction, adduction. Abduction, adduction. Abduction, adduction. Abduction, adduction. And let's repeat the procedure to the other toes. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Then we also have flexion, extension. Flexion, extension. Flexion, extension. Flexion, extension. Flexion, extension. Next, let's place side rails in original position to provide client safety. And then, let's repeat the range of motion exercises done in the right side of the patient to the left side. for range of motion exercise for shoulder, we have hyperextension. 1, 2, 3, 4, 5. And then ROM exercise for strength. So we have here flexion, extension, and hyperextension. Flexion, extension, 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 hyperextension. Next is lateral flexion. 1, 2, 3, 4, 5. Lastly, shank rotation. 1, 2, 3, 4, 5. After that, replace covers and position client in proper body alignment to provide client comfort. Place side wells in original position. After that, place colite within reach. That's all for the exercise today, ma'am. Do you want me to get something else for you, ma'am?
No.
Okay, ma'am. So thank you very much, ma'am, for your cooperation. After that, wash hands to prevent transfer of microorganisms, and then do charting. Evaluation, client has maintained or improved current functional mobility in all involved joints and extremities. Next, client has regained or improved strength or voluntary movement in involved joints and extremities. And lastly, client has avoided complications of immobility.